Okay, so now I'm going to teach you guys the ilium mobilizations, and just a reminder what we're going to do for these. So you're going to want to do 2 to 3 sets of 60 seconds of oscillations. If for pain, you're going to want to stay in that 1 to 2 grade range, and for range of motion, you're going to want to go to that 3 to 4 grade range. And pretty much what you're going to do for this mobilization, you're going to want to take one hand and stabilize the sacrum right here. And then you're going to reach the other hand around to the opposite ASIS, and you're going to want to pull your patient into a posterior and medial direction like so. And remember, you're going to be doing this for 60 seconds, 2 to 3 sets. Okay, so now I'm going to teach an anterior mobilization of the PSIS. And so how we do this is first we're going to locate the PSIS on our patient, and that is right there. And then once we do that, we're going to place our hands slightly medial to that PSIS, and you're going to want to push down in an anterior lateral direction like this. And it's the same prescription as the last joint mobs that we taught as well.
So for the next technique, we're going to be performing a lumbar rotational manipulation. So we're going to have the patient start in supine and then ask him to roll onto his right side. And we're going to try and have him get as close as he can to the edge of the table here. And our table height should be about knee to our knees, right, this one. And then what we're going to do is we're going to have him tuck his top foot underneath or behind the back of the knee on this side. And this top side is the side that we're going to be manipulating. Next, what we're going to do is we're going to bring our thigh against his thigh like this. And we're going to take his shoulder and kind of get him into that full rotation there, just get more of a stretch. And then the last step what we're going to do is we're going to have him bring his arms, have it relax just like that. We're going to take our forearm, go over the axilla, and then we're going to take this right hand and we're going to go right over the PSIS like here. And then when we apply our force, we're going to be going straight down. So in order to initiate the manipulation, we're going to have him take a deep breath before we do it, and we're going to do the manipulation at the end of his exhale. So we're going to do a practice run first before we do the actual thing. So I'm going to have my patient take a nice deep breath in, take out that tissue, and then straight down is what we're going to be doing. So on this go, we're going to have you take a deep breath in, and then at the end of the exhale, we'll perform the manipulation. So deep breath in, and out.
So this next technique is called the leg pull. So what we're going to do first is you're going to take the leg, you're going to distract it while also dorsiflexing the leg, and you're going to hold this. You might feel tension in different areas of the leg. You could feel it in the gastroc, the hammies, or like in the hip joint itself. You're basically just going to hold this here until you feel that tension kind of release, and then you're going to kind of externally rotate the leg a little bit and come out a little bit more into abduction. Same thing here. You're going to be just waiting until that releases, and then you would move up a little bit more into hip flexion. Same thing applies here, and then while keeping the distraction, you're going to come across this side into some abduction. It's a little tougher to keep the dorsiflexion here, but you really just want to keep the distraction as much as you can. Same thing, you're kind of holding that until it releases. And the whole treatment should take about 3 to 5 minutes. All right, so this next technique we're gonna do is a myofascial release of the lumbar region. And it's called a cross hand release because your hands are gonna be crossed. So first you're gonna wanna assess where the fascia is the tightest. You can do diagonal, you can do vertical. I'm feeling the most tightness on his right side here, so I'm just gonna treat this part. So basically, you're gonna keep your hands flat, not applying a lot of pressure. You're just gonna slowly kind of pull the fascia apart, kind of keeping your hands still. And you should start to feel over time that your hands are slowly moving further apart. And the patient should also be feeling a pretty good stretch here. This is also gonna be held for 5 minutes.
All right, so for the next technique we're going to do, it's going to be an iliopsoas release. So you're going to have the patient lying supine for this. You're going to want to elevate his leg slightly, put in some hip flexion, and then we're going to want to palpate until we find that ASIS. We're going to travel about 2 inches medial. we find that spot, we're going to slowly sink our hands into the patient's body using kind of that hook technique, applying that pressure, holding it, and then gently increasing our pressure, going down until we can start to feel that iliopsoas release. Alright, so these are our muscle energy techniques that we're going to use to correct any rotational innominate dysfunctions or pubic symphysis dysfunction that our therapist noted in the evaluation. So for the first one, when we're correcting the anterior pelvic tilt, what we're going to ask our patient to do, we're going to passively flex their hip all the way until I feel a restriction, and then you're going to ask your patient to recruit their glute muscle fibers and submaxillary contract against me, and then relax. We're going to ask our patient to contract for 3 to 5 seconds, and then we're going to move further into that range after you relax, 3 to 5 times each one. And then for our posterior pelvic tilt, we're going to ask our patient to slide to the edge of the table towards me. And then we're going to bring that leg into some of that extension, so the passive restriction. Ask them to recruit their hip flexors muscles to contract against me. And then relax. And slowly move further into that range with the same exercise prescription. So for the pubic symphysis dysfunction, we're going to have our patient lying in the middle of the table. We're going to start with them closely in, with the abductors, asking them to recruit them in submaximal contraction for 3 to 5 seconds. Relax, and keep moving further out into that range. Relax for 3 to 5 times. And then we're going to switch from this position into our abductor recruitment and a cross hand technique, asking our patient to contract against us and relax. Slowly bringing in closer to that range until we finally get to the end, and asking our patient to contract against us. Good, and relax.